So we come to the practical work for the client with plantar fasciitis, and we're going to start just with some very gentle stretches of the foot. We're not doing too much of this at this point. It's more kind of an assessment. How much does the foot move? Where can we feel that tension? And there is limited movement there. So there's tension here in the arch, and there's tension that is going to come right up here into the calf, into the belly of the calf. So that's where we're going to work. We've already done the footwork, some of the footwork. We'll just show it very briefly. So we've worked all of the toes, as we have with the footwork. So we've already worked all of the toes. You've already seen that in the foot video. And the difference here is, as we're coming up much more into the side. You can see that kind of squeezing and pressing, almost like kneading the side of the foot. But what we're not going to do is any work here, because this is where the problem is with the plantar fasciitis, and because we've got those micro tears, micro cuts in there. If I put any pressure on there, Bev is going to leap off the table because it's going to be really painful. It's somebody pressing on it with a thumb is kind of the equivalent to somebody getting up out of bed in the morning and walking up on it for the first time. So it will be excruciatingly painful. So in all of our massage, we avoid any pressure around this immediate area. If we're working up into the heel, we're coming above it so that we're not squishing this part of the heel at all. So reiterate, avoid this whole area. So we've already worked all of the toes. We've started to do this work down the side of the foot. And we want to pay a little bit more attention here than we normally do in our footwork to the arch, because the arch is one of the areas where it can hold tension that can affect the plantar fascia. And if you remember, we're kind of working around the Achilles. It's coming all the way up to here and all the way down to here. So that's the area that we are focusing on. You can see I'm doing this press and release. I'm doing a little bit of a roll as we go, and I've already worked the top of the foot as per the foot massage video, but I'm just spending a little bit more time doing this work into the arch, and I can feel this kind of band coming down here. So that's what I'm working. If I want to work it a little deeper, where I've got Bev's foot supported, I can just extend. I can do that stretch while I come into here, and that allows me to get into the arch even deeper. Now that will be a little bit tender, so do it carefully. I've been working with Bev for probably 13-14 years, so I know her depths. And I know when it's I'm working a little bit too deep, and as I pressed into there, or just off camera, her head lifted up off the table, which shows me that I'm at the maximum depth. So I don't need to ask here. I can take the non-verbal cues from my client. If it's a new client, check in, ask the depths. How is that depth for you? On a 1 to 10 scale, where 1 is I can tell you there, and 10 is why did I book this massage, where am I? And depending on where they want to be, some people might only be happy going to a 4, others will be going, give it an 8. I want to get rid of it, I want to get it sorted. So once we've done that footwork, working the whole of the sole of the foot apart from this area with the heel, we're coming up to the top of the heel. Now you can see I'm kind of at the bottom of the ankle, the very top of the heel, so I'm not moving this area here. I'm not moving the heel itself. I'm moving the area at the top. Now, if you're working with someone who's pregnant, of course, you avoid this particular point. It's contraindicated in pregnancy. And we can see what the movement of the foot is like. So as we lift the foot, how much movement are we getting there? We can see it's improved a bit just by doing that footwork. So now we want to start moving up into the calf and starting to get some movement into there. We'll introduce oil at this stage. We've not used any oil on the foot because you'll just slip off. So plenty of oil. I'm warming the oil myself first. You can see I'm following up the middle of the calf, where you then get the calf belly separates, I'm separating. You're almost making kind of like an extended love heart. For somebody with plantar fasciitis, this will be tender as you come into here. So you can see this is kind of warm-up depth at the moment. I'm applying pressure as I'm going up, and I'm taking my pressure off as I'm coming down. You can also come up the outer bit of the calf so that you're working the whole of the calf. And so although I'm stroking back down, that's all I'm doing. I'm just stroking back down. My pressure is always upwards. Pressure up towards the heart. Right through there. And then I'm going to come back into the arch again. Now I have got a little bit of oil on my hands, but I'm not going to worry about that now because I'm not working the toes, I'm working into the arch. And I might spend a good 10 minutes working between the arch and up into the calf, the arch, up into the calf. Because as one starts to loosen, so the other will loosen. Now what you've got to watch for is that if somebody's calf is really tight, as you do that work, they'll start to cramp. Whenever I massage my husband, if I go remotely, if I went at half the speed I'm going now, it will cramp. You'll see him in the video demonstration on cramp, and quite possibly he will get cramp in the middle of the treatment. He's just very prone to it. So if you have a client who is prone to cramp, just work really, really slowly. And then we're going to do some deeper stretches to finish. Now, of course, we can also do that work up the front of the leg. We shouldn't neglect that. Working the outside of the shin. But then we're going to encourage that deeper stretch. And as somebody with plantar fasciitis, Bev will already be doing some of these stretches, and some of those are described in the textbook. But you can see now we're getting more movement in the foot than we did previously. So it's all of the footwork from the foot and leg video. It's the leg work at least to the knee. If somebody's just coming in specifically for plantar fasciitis, you can just work to the knee. If they're coming in for a bigger treatment, just carry on all the way up. But then it's really focusing on the arch, up through into the heel, and then those connections up into the calf. It will still take time. It won't be an instant cure for plantar fasciitis, but it should speed up treatment and it should speed up the healing process.